Next, coming to the pathophysiology. So, why newborns are more susceptible to develop seizures are because of the enhanced excitability. So, inherently, even the inhibitory neurotransmitters like GABA or excitotoxic, or it is an excitable neurotransmitter, not an inhibitory neurotransmitter in a newborn. And newborns have more synapses and dendritic spines are present, and there are abundant glutaminergic neurons. So, it is basically a hyper excitable state. So, as you can see here, glutamate is a excitatory neurotransmitter, but GABA is an inhibitory neurotransmitter. But what happens in newborns is the GABA acts on its GABA channel, and instead of retaining the chloride ions inside, what happens that it causes hyperpolarization and causes efflux of the chloride outside. So, once the chloride is effluxed from the cell, it results in a depolarized state. So, GABA will also act as an inhibitory neurotransmitter in newborns. So, is there a problem with newborn seizures? Why are we so concerned? When there are repeated seizures, ultimately that results in brain injury. So, how does this brain injury happen? So, when there are repeated seizures, there will be increased blood pressure, there is hypoventilation, or the baby is in apnea. Because of the increased seizures, the cerebral blood flow or the cerebral perfusion increases. But there is hypoxemic, relative hypoxemic state. So, the ATP levels will decrease, there will be anaerobic glycolysis. So, lactate accumulation will be present, the glucose in the cerebral circulation will decrease. So, because of hypoxia, lactic acidosis, hypoglycemia ultimately results in a cerebral blood flow increased, hemorrhage, and ultimately there is brain injury. So, this is how brain injury happens because of repeated seizures. So, the newborn seizures differ in many ways from the older children. So, why we have seen certain characteristics already, and these are also again the similar presentation only. So, one thing is the immaturity of the brain development, more and more of dendritic spines and more of synapses, and there is undermyelination of the axons. So, this is why the most of the seizures, that is around 50% of the newborn seizures, are actually subtle rather than generalized tonic or generalized clonic seizure. And also in a newborn seizure, because of the undermyelination, there is no proper progression of the convulsive activity. So, it is the seizures actually progress very disorganized state, and it is not in an orderly progression that like that we see in an older child. So, you can have certain differentials based on when the newborn seizures actually occur. So, if it occurs in the first 24 hours, you have a set of differentials in the next 2 days and in day after day 3. So, in the immediate, in the first day of life, if there is a seizure activity, our first and foremost differential is of course HIE, perinatal asphyxia resulting in HIE. Next, infections. So, CNS infections and other intrauterine infections. And birth, trauma, any drug withdrawal in the mother, like especially maternal opioid withdrawal, vascular etiologies like a stroke, or pyridoxine deficiency also can occur in the first 24 hours. So, most common will be HIE and intrauterine or CNS infections. Next, in the second day of life, again severe HIE will present in the first day. Second day of life, mostly it is either structural brain abnormality or metabolic disorders like IEMs, etc. So, structural abnormality in the brain will be cerebral dysgenesis, any cerebral dysgenesis, vascular, of course, any stroke or IVH, intraventricular hemorrhage or thrombosis, etc. Next, metabolic complications, it can be hypoglycemia, hypocalcemia, hypernatremia, etc. or urea cycle disorders, organic acidemias. Pyridoxine deficiency can be seen here also. More than 72 hours, after 3 days, still structural abnormalities we have to think of. Vascular events will also come here, inborn errors of metabolism and familial newborn seizures you have to think of. So, first 24 hours, second day and after 72 hours, what are the differentials you can keep in your mind.